Began as a trucker convoy, but now it has gone and become something much more. We're going to keep our eye on that and give you all the updates, too, in terms of what police action might be in Ottawa. There's also concern in Toronto about protests this weekend, Quebec City this weekend as well. All right, let's go to the Ontario COVID update, though. Dr. Kieran Moore is speaking.
On Monday, Ontario started the gradual reopening, and I want to thank Ontarians for the sacrifices they have made that allowed us to get to this point. Because of your efforts to help blunt the transmission of Omicron, our healthcare indicators suggest a general improvement in the COVID-19 situation in the province. Thank you. Lundi dernier, la réouverture de l'Ontario a commencé graduellement.
The reopening of Ontario started gradually, and I thank you for your patience. I want to thank all Ontarians for all the sacrifices that allowed us to arrive at this stage. Thanks to your efforts to mitigate the transmission of Omicron, our healthcare indicators signal an improvement, generally, of the COVID-19 situation in the province.
Some areas of the province still have precarious and strained healthcare capacity, and we still need to come together as a province to support all regions as we move ahead in our reopening. While the coming weeks will continue to be difficult for our hospital system, the number of hospitalizations is currently stable, and given current trends, we are more confident in our ability to ensure capacity across the province so that all Ontarians can get care at the right time and at the right place. ICU numbers remain high, but the number of COVID-19 patients are now starting to decrease, and we have increased capacity to provide care to those who need it. The percent positivity of tests continues to decrease, with our average this past week declining to 14.64% from 18.4% the week prior. Based on the current stabilization in Ontario's testing strategy, this is likely reflective of a real decline. Long-term care outbreaks are also declining, and we recently saw the first decline in the number of active resident cases in long-term care since the Omicron variant became the dominant strain. There's also been an increase of wastewater sites across the province reporting a downward trend in COVID-19 detections. These trends are encouraging, but we must remain vigilant and adhere to the measures that are helping reduce transmission, such as staying home when you're sick, wearing a well-fitted mask, distancing, and getting vaccinated and boosted. These individual actions will lead to our collective protection. I also want to take this opportunity to acknowledge our educators, parents, and students for their dedication to making the return to in-person learning as successful and as safe as possible. J'aimerais aussi saisir l'occasion de reconnaître
take the opportunity to thank our educators, parents, and students before that went with their return to in-person teaching as quickly as possible.
Approximately 13.3% of students and staff were absent each day, and over 94% of schools have reported less than 30% of students and staff absent. We also saw less than 1% of schools were closed each day, so only 7 out of 4,844 schools. And these closures are typically due to operational challenges such as staff shortages. Keeping our children and youth in school is critical to their mental health and well-being, and I thank you for all the support you're doing for our children's academic success. In addition to all the measures in place at schools to help them remain as safe as possible, vaccination is also a key. And the vaccines we have are safe and effective and the best way to protect our children from COVID-19. To date, 87.1% of Ontarians aged 12 to 17 have received one dose of a COVID-19 vaccine, and 83.6% are fully vaccinated. And we continue to make progress in our vaccination campaign for our 5 to 11-year-olds. 53.9% have received one dose, and 20.2% are fully immunized. We increased that by 10% in January alone. So thank you to the parents. As we seek to improve our immunization rates in our youngest eligible age group, it is our goal to ensure that parents of children feel well informed and safe when deciding to have their children immunized. The Children's Health Coalition, in collaboration with the Hospital for Sick Children, has launched a children's vaccine confidence campaign to provide parents and caregivers with information to make an informed decision. Parents, caregivers, and children are also encouraged to call the Provincial Vaccine Confidence Line or book a confidential phone appointment with Sick Kids clinician through their COVID-19 vaccine consultation service. I know that for parents, nothing is more important than the health and well-being of their children, and having credible sources of information they can rely on to be scientific and factually correct is important. The resources are there to help you answer all the questions you may have, as are your trusted healthcare professionals. Je sais que pour
I know that for parents, nothing is more important than the health and well-being of their children. It's therefore extremely important to be able to rely on credible sources of information based on science and facts. The resources are at your disposal to help you answer all your questions, just as are your healthcare professionals.
Though vaccination remains key, we do have antivirals available to help us manage the impact of this virus. Because of the limited supply of Paxlovid, which is an outpatient oral treatment, we are prioritizing the distribution to unvaccinated individuals who are at risk of severe outcomes of COVID-19 infection, including hospitalization. This includes unvaccinated seniors aged 60 and over, First Nations, Inuit, and Métis individuals aged 50 and over, and individuals aged 50 and over with underlying risk factors. We are also prioritizing immunocompromised individuals 18 and over, regardless of their vaccine status. As of today, 12 treatment courses of Paxlovid have been distributed through the 15 sites. Though it is no substitute for immunization, Paxlovid is available and will significantly reduce the risk of hospitalization if taken within 5 days of symptom onset. And in the randomized controlled trials, they reduced the risk by 88%. If you think you may be eligible to receive Paxlovid, you can contact your primary care provider, call Telehealth Ontario, or visit a COVID-19 clinical assessment center. Si vous pensez être
If you think you're eligible to the Paxlovid treatment, you can contact your primary health care provider or Healthcare Ontario, or go to a COVID-19 testing clinic.
I also wanted to mention an update on our PCR testing eligibility. We continue to prioritize PCR testing for those at the highest risk of severe outcomes, including those eligible for COVID-19 treatments, such as antivirals, those who work and live in the highest risk settings, and patient-facing healthcare workers. We are expanding eligibility to now include household members of patient-facing healthcare workers in order to support timely identification of cases in healthcare workers and ongoing delivery of healthcare services. I want to thank Ontarians for the sacrifices they have made and for their continued cooperation when it comes to following the public health measures that we know work. Your actions are having an impact. The trends are looking positive, but we must remain cautious, and our continued reopening efforts must be implemented cautiously. Thank you. Merci.